Every athletic trainer at Athletico has gone through courses to specifically how to manage and to evaluate a concussion. Each concussion obviously is treated very individually, and each person is going to react from a concussion very differently every time they're hurt. So it's important that each athletic trainer is trained to pick up on the special nuances, and we go through many different types of testing protocols to pick up on those little nuances. One thing that Athletico has started recently is working with our vestibular physical therapy program. What we do after 7 days, if the athlete is still symptomatic, we start to get curious if there are other means that can make this athlete better a little more expeditiously. We screen them to see if they're having any type of balance deficits or visual deficits, which would make them a good candidate for vestibular physical therapy. For those candidates who are a good candidate for this, we could get them back sooner utilizing this type of physical therapy.
At Athletico, our trained physical therapists that are involved in our concussion service line can treat patients with prolonged persisting concussion symptoms by prescribing exercises in order to resolve complaints of dizziness, prescribe exercises in order to improve static and dynamic balance exercises, work to improve a patient's tolerance for cardiovascular exercise, because a lot of these individuals will complain of headaches and dizziness with exertional activities, and finally work on agility and sports-related drills in order to specifically prepare them to return to their line of athletic activity. An individual that's sustained a head injury and is unsure if they have prolonged persisting concussion symptoms may have feelings of dizziness when they're in a busy environment or with any exertional activity, persisting headaches more than they would normally have, difficulty focusing on schoolwork or concentrating, excessive sleeping or not sleeping enough. Parents may also get reports from school that their child is showing a decline in their academic work. So these are all areas where if you're noticing these issues, you may want to have your child evaluated by somebody who understands concussions.
What we're going to do is walk this way, turning your head from right to left.
If your concussion symptoms do not go away or are lingering longer than 10 to 14 days, at Athletico we recommend you see a vestibular physical therapist who specializes in concussions in order to get a complementary screen where your balance will be tested, your head and eye coordination will be tested, your symptoms will be discussed, and then if it's deemed appropriate, you will be referred out to a physician who is capable and comfortable treating prolonged persisting concussion symptoms. And this would probably be an individual who would be appropriate for a more extensive vestibular therapy program, which usually is about 4 to 8 weeks of therapy in order to help resolve those symptoms.
As far as preventing concussion, the main thing is making sure that all equipment is in proper working order, that helmets are properly inflated, and that all the equipment works properly. Another thing that parents and coaches can do is make sure that there is limited aggressive hitting during practices, and teaching athletes the proper way to block and to hit. At Athletico, our goal with getting a concussed patient back into play is to really focus on what their specific sport is. As an Athletico clinician, I understand what a basketball player needs to do to be able to get back out on the court, what a soccer player needs to be able to do to get back on the field, and even taking into account what different positions that they need to be able to play. A concussed midfielder is going to have a very different need than a concussed goalie. A concussed quarterback is going to have a different need than a concussed lineman. So at Athletico, we understand all of the different components that go into each of those positions, and we will work to create an individual program for that particular athlete to help get them back to play.